and distinguished Professor Dr. Vivek Kasradkar, sir, Professor and Head, Department of Veterinary Clinical Complex, Veterinary College, Bidar. And he is having experience of 30 years. That is a very huge experience in academics as well as research. And he is having area of expertise in ketosis in buffaloes and lactic acidosis in goats. Sir has handled several projects. He acted as a co-PI in NATP project on weather-based animal disease forecast, and also acted as a PI in two university-funded as well as two extramural funded projects, and co-PI in many other university-funded projects. He is having around 50 publications of national and international repute, has guided around 10 MVSc student and one PhD student. And definitely he has, as having 30 years experience, he has attended several national and international conferences. And sir has been bestowed with many awards to his recognition, including Best Clinical Paper Gold Medal by Indian Veterinary Association, then highest OGPA Gold Medal in Doctoral Studies. He has also organized several trainings as course director as well as course co-director, which were sponsored by Department of Animal Husbandry, that is Karnataka Veterinary Council, and ASCA trainings for field veterinarians. So I request Dr. Kasradkar sir to start his lecture on metabolic disorders with special reference to SARA and ketosis. Thank you, sir.
Thank you, Dr. Jadhav, Dr. Pajai, the whole organizing team. Am I audible to everybody?
Yes, sir. Yes,
Yes, sir.
Okay. So shall I share my screen?
Yes. Yes, sir.
So, good evening, all the participants. Is the first slide visible, Dr. Pajai?
Yes, sir. Yes, sir. It is visible, sir.
Okay.
Right, sir.
Yeah. Let us go to the next slide. So, my topic of discussion today evening is bovine ketosis and subacute ruminal acidosis. Both the topics, they are of special interest to me because I have worked for my postgraduate research on ketosis, and my doctoral research was on lactic acidosis. So there was, before going to the actual topic, I just wanted to share some brief information about why the production-oriented diseases, they have got enormous importance because that gives a lot of stress to the dairy industry. So this slide shows you that how much of loss and the revenue generation is there with the dairy industry. 64,000 crores. That is the contribution of dairy sector to the economy. And it's pretty clear now that the periparturient diseases, they are the one which are more commonly encountered between 3 to 4 weeks prepartum and 3 to 4 weeks postpartum. Okay, and this economic loss due to the periparturient disease in the form of loss of milk production is only a tip of iceberg. Okay, so great loss is there because the animal has to resume its milk production over a period of time in spite of giving a therapeutic regimen to the animal to come out of the production-oriented disease. Let us go to the next slide. This particular, concept was put forth by a Grummer in 1995, who was professor at University of Wisconsin. And before going to the the topic bovine ketosis, I just wanted to share this important information which came as a research paper during 95 and 96. Dr. Grummer, he pointed out 5 critical points to be kept it in mind, which will prevent or which will reduce the occurrence of periparturient diseases. What the farmer or dairy management team has to keep it in mind, the first point is the dry matter intake. Most of times while feeding the dairy animals, the dry matter intake is neglected, and that is the major issue which precipitates the occurrence of periparturient disease. So that's why a emphasis should be given to maximize the dry matter intake, because there is already a lot of research and the the statistical evidence to say that there is a correlation between low DMI, that is dry matter intake, and there is a high incidence of PPD. Anyway, when we will discuss ketosis, this point we will once again discuss at length what is the importance of dry matter intake. And there is already a positive correlation between the decline in dry matter intake and elevated non-esterified fatty acids. So this elevated non-esterified fatty acids, that is called as NEFA, is responsible for hepatic lipidosis and making the animal more prone for ketosis as well as fatty coursing. So what is the remedy? Remedy is you have to monitor and correct the dry matter intake, and at least 10 to 15% of roughages in diet should be there, so that there is a appropriate what you can call it as propionate production in the rumen. So that will reduce the negative energy balance in the animal. And nowadays a lot of stress is there to incorporate ionophore antibiotics, because these antibiotics basically they improve the propionate production in the rumen. Thereby the gluconeogenesis to which the ruminant animal is very much dependent is potentiated, and thereby the incidence of ketosis like disease can be reduced to great extent. The second most important point is the length of ruminal papillae. Okay, rumen papillae plays a very important role, because these are the length of the rumen papillae is directly proportional to the absorption of the fatty acids in the rumen, volatile fatty acids in the rumen. Okay, so it has been already identified that if the acetate production is more in the rumen, it is responsible for the reduction in the length of rumen papillae. So when the reduction in the length of rumen papillae is there, the absorptive surface in the rumen gets reduced. So thereby it induces, it causes much of the damage to the rumen ecosystem. Okay, so that's why high propionate and butyrate is desired as a byproducts in the rumen. So thereby it can promote the glucose absorption in the ruminant animal. So then what are the remedies? Remedies in Western concept, if you look at, grain is a essential part of the diet, but what they call it as conditional adaptation to the grain. So the grain concentration, grain incorporation in the diet should not be 1.5 to 3 kg per day, because grain contributes a highly fermentable carbohydrate in the rumen, and it promotes the lactic acid production. Lactic acid production ultimately changes the balance between the volatile fatty acid and the lactic acid, and thereby reducing the ability of the rumen ecosystem to have a better production of volatile fatty acids. And that's why effective fiber content also should be promoted, so that the rumen papillae development takes place in the rumen, and the papillae length will be appropriate for the absorption of the essential volatile fatty acids. Then the third and most important aspect of the critical point to be kept it in mind is the calcium homeostasis, and this is directly related with the precipitation of the hypocalcemia and what we call it as milk fever precipitation in a farm. So what it has been identified that factors that responsible for calcium homeostasis is the parathyroid gland. Parathyroid gland plays a very important role in calcium homeostasis, because parathormone comes to the rescue of the animal when there is a hypocalcemia. In the hypocalcemic state, the parathyroid gland is stimulated. It releases the parathormone. Parathormone, with the help of osteoclasts, it is able to drain the calcium from the major calcium depots, and thereby try to bring a balance between the low calcium level or calcium which is coming down in the system. Okay. So, but what has been observed that as the age of the cow advances, there is a decreased osteoblast and osteoclast pool in the systemic circulation. So thereby, even parathormone is there, there is inadequate osteoclast. So thereby, calcium drain from the major resources is also going down. So that's why incidence of milk fever is high in the aged cow or older cow, because sufficient osteoclast pool is not there. So thereby, even in spite of presence of parathormone, there is a decreased calcium drainage from the storehouses like major ports. Okay. Then it has been also very clearly pointed out by the research findings that the prepartum diets which is high in calcium is always responsible for depressed homeostasis, because they say that the parathyroid gland goes under sleeping mode. Okay, so the word very specific, the sleeping mode. Parathyroid gland doesn't understand if the high calcium, if the calcium in the system is more, the parathyroid gland is sleeping mode. So immediately after parturition, when there is a sudden drain of calcium in the milk, parathyroid gland doesn't get stimulated, and because of that, the parathormone is not released. Apart from that, more emphasis nowadays is given in dietary cation anion balance. So this has clearly indicated that if the diet is high in sodium and potassium, it increases the risk of milk fever. Whereas the diets which are high in chlorides and sulphates, they lower the risk of periparturient disease, especially the hypocalcemia or milk fever. And that's why ammonium chloride has been promoted as a preventive strategy for the lowering the incidence of milk fever. So what is the remedy? Remedy is the record monitoring should be done on the farm. Metabolic profiles of individual cows should be monitored, and accordingly, if there is any decline in any specific component, the dietary modification has to be done. Okay, and it has been well understood that during periparturient period, the routine 2.1:1, whatever the calcium phosphorus ratio, has to be reduced. Low calcium, high phosphorus diet should be fed during the prepartum period to avoid the occurrence of milk fever immediately after parturition. Okay. Then minimize the negative energy balance and the protein, especially the amino acids. Okay. So the negative energy balance and low proteins, they cause the irreversible loss or irreversible change in the metabolic shift. Everybody understands that during the periparturient period, 3 weeks prepartum and 3 weeks postpartum, the animal is undergoing a lot of metabolic shift, and the body should get adjusted to that. If it doesn't adjust, then one or the other periparturient disease is likely to precipitate, and the animal will be coming down to the one or the other periparturient disease. Okay. So what has been what has to be kept it in mind, that the negative energy balance should be reduced and the protein intake should be improved, especially the amino acid supplementation. Okay. So the remedy is in energy boosting food additives like propionates, amino acids should be a part of your diet of a dairy animal, and metabolic profile should be always tested so that you will be able to see the metabolic shift, and accordingly you can bring out the dietary change, and thereby you can avoid the precipitation of either ketosis or milk. Then the other fifth point to be kept it in mind, that minimize the immune dysfunction. Everybody knows that when the animal during the late gestation as well as during the postpartum period, it is under the influence of cortisol, and the animal is having a compromised immunity. So compromised immunity makes the animal makes the dairy animal during the periparturient period to increase the susceptibility to variety of disorders, which includes mastitis, metritis, and most of the other infectious diseases. So that's why the remedy is increase the trace mineral supplements, because trace minerals, they play a very vital role. Sometimes they can be acting as a bioenzymes for multiple type of the cycles which are going on in the body. And vitamin E has been found to be very effective as an antioxidant, and thereby it has been already advised 2000 international units of vitamin E should be supplemented as a vitamin supplement to improve the immune function in a periparturient. So that's why this is the final call for the metabolic profile testing. And a larger farm, metabolic profile testing should always be a priority. And this concept was kept by Paine and co-workers in 1972. So that is that has been renamed, that has been named as Compton's Metabolic Profile Test. In short form, they call it as CMPT, Compton Metabolic Profile Test. So Compton is a place where a roundtable conference was held in Great Britain. Compton is a place in Great Britain where a roundtable conference was held, and there the Paine and their co-workers, they put forth the concept of metabolic profile test, and that's why it is named as Compton Metabolic Profile Test. So they stressed upon the input, throughput, and output. So input is directly related with the output, and throughput is the feedback mechanisms which are present in the animal, which tries to make a balance between input and output. Input is nothing but the dietary intake of the animal, output is nothing but the milk production, and throughput are the feedback mechanisms which are already present in the animal. Okay. So that's why the Compton Metabolic Profile Test suggests 13 blood and biochemical parameters to be done in dairy animals. You have to divide the dairy animals on your farm into 3 groups: dry cows, medium milk yielding cows, and high milk yielding cows. Okay, and you have to collect the blood samples during 3 seasons: summer, autumn, and winter, and you have to correlate, and you have to have a population mean. Okay. So if there is a 2 standard deviation of any value from the population mean, it indicates that the animals or the dairy animal especially is having an inclination towards either hypocalcemia, hypoglycemia, hypoproteinemia, and this has to be identified, and necessary dietary modification has to be done so that a particular disease doesn't precipitate and it doesn't cause a loss to the dairy farm. Then in 1975, this one more concept came into the because the Compton Metabolic Profile Test, it has got about 13 parameters, and then it should be done in 3 groups in the 3 different seasons. So it was little bit what you can call it as time consuming and cumbersome. So Parker and Blovey in 1976, they put forth the idea of mini profile test, MPT. So CMPT has become MPT in 1976. So this is less time consuming. It has got more or less same predictability as that of CMPT. And they say that only 3 parameters has to be monitored during pre and postpartum. Which are those 3 parameters? The glucose, the urea nitrogen, and total protein and all. So if these 3 parameters, they are steadily monitored in a periparturient animal, you will definitely have an idea whether the animal is going away from the normal parameters or not. And if it is going towards the declination of any of these parameters, immediate remedial measures to be taken up so that you will avoid the occurrence of any periparturient disease in a dairy animal. Okay. Now let us come down to the main topic, bovine ketosis. So bovine ketosis is already identified as a disease because of the negative energy balance, and the basic biochemical defect in ketosis is hypoglycemia. Now, the glycemic control or the glucose metabolism in ruminant is slightly different than that of non-ruminants, that is simple stomach animals. Okay. So this hypoglycemia, what you have to understand that why the hypoglycemia in ketotic animal or a dairy animal is likely to happen. Okay. One is the propionic precursor deficiency. The diet which you are giving to a dairy animal, it does not yield the requisite quantity of propionate in the rumen. And propionate is considered as a glucogenic type of substance because that contributes for the oxaloacetate. In pathogenesis, we will understand how the propionate and oxaloacetate they are related and how oxaloacetate plays an important role in reducing the acetyl coenzyme A in the system. Okay. The second and foremost important is hepatic insufficiency. What happens? Well, we have already discussed at length in the critical points that already a dairy animal is having a lot of stress, and this stress leads to hepatic lipidosis. Okay, so liver is a major organ, what you can call it as, which stores glucose in the form of glycogen. Okay, so when there is a emergent need of glucose in any animal, the first thing what is happening is glycogenolysis. Okay, so the glycogen in liver breaks down. Glycogen is a polymer or polysaccharide, you can call it as, which breaks down and supplements the glucose wherever it is required. But already a dairy animal is compromised, and the dairy animal's hepatic stores of glycogen, they are replaced by the fatty tissue. Okay, so the hepatic insufficiency is there, hepatic lipidosis is there because of much of the non-esterified fatty acids entering into the liver, and liver doesn't come to the rescue of the animal which is suffering with ketosis, and thereby there is a hypoglycemia. The other factor which already in milk fever, it has been well established that around 23 grams of calcium is drained in single milking. So I was just yesterday I was trying to find out there is about 4.7 grams of lactose. Okay, in about the milk. So 4.7 grams of lactose, you can imagine how much of glucose is required. So there is a glucose drain in the animal, and it brings about a stress, and that also creates a state of hypoglycemia. So in ketosis, the primary biochemical defect is hypoglycemia, and this hypoglycemia triggers the further resultant gluconeogenesis, and then ending up into a ketotic stage. So let us go to the epidemiology of this ketosis. The highest incidence, they say that about 4 to 6 weeks, but the danger period, it can go up to 2 months postpartum, 4 to 6 weeks postpartum. There is likelihood that the animal may have a chance of getting ketosis. Then dairy animals in 3rd to 4th lactation and aged between 5 to 7 years, they are having highest susceptibility. So it is a correlation. Okay. So the milk yield in a dairy animal is highest milk yield, what they call it as lifetime highest milk yield, is attained in 3rd to 4th lactation. So because of that, the animals which are in 3rd to 4th lactation, they will have highest susceptibility because lactose drain will be highest in the highest milk product. Apart from that, 5 to 7 years, why it is correlated? Because it is presumed that around 2 years, if you take it as puberty, and every 1.5 year one calf is given, so you can see, you can very easily identify that the animal will be weighing around 6 to 6.5 years, where it will have highest milk yield, and thereby it will have highest drain of glucose in the milk, and thereby it is making it more susceptible to ketosis. Okay. The incidence is more during winter. There are 2 reasons for that. In winter, there is a high energy requirement to maintain the balance. Apart from that, most of the the calvings, especially in buffaloes, they occur during winter. So there is always a high risk of occurrence of ketosis during winter. Then, when you compare with the cows and buffaloes, they have more susceptibility than the cattle. Among the crossbreds and desi animals, crossbreds they have more inclination to have a ketosis because they are high milk producing animal than that of the desi animal. Amongst breeds, HF cross, they have more susceptibility than the jerseys. You must have seen that milk fever, the jerseys, they are more susceptible to ketosis when compared to the HF. But there is a documentation that Holstein Friesian crosses, they have increased susceptibility when compared to the jersey crosses. Okay? And this already we have discussed. The hepatic insufficiency increases the susceptibility during the postpartum period because of the high body score. Usually, body score and it goes hand in hand. Okay. Now, the concept of ketosis, you have to understand here how ketosis develops. Okay. So what happens when there is a in normal course? What happens is the beta oxidation also goes on the Krebs cycle. This on the left side, what you are seeing is the left Krebs cycle, where it has been shown that the byproduct of beta oxidation or gluconeogenesis is acetyl coenzyme A. So routinely acetyl coenzyme A is produced in the body, but whatever acetyl coenzyme A is produced in the body, it combines with the oxaloacetate in Krebs cycle and it gets oxidized. Okay, so there are possibilities that this oxaloacetate itself is deficient, and acetyl coenzyme A will not be utilized in the Krebs cycle. Okay, so when it can happen for oxaloacetate propionate or propionic acid is a precursor. So propionic acid or propionate in the rumen through methyl malonyl pathway, it enters into the Krebs cycle in the form of oxaloacetate. So the source of oxaloacetate is propionate in the rumen. So naturally, if the propionate production in the rumen is suppressed, the oxaloacetate in turn will also get suppressed. And because of that, acetyl coenzyme A, which is normally produced through beta oxidation, does not get utilized through the Krebs cycle. Okay, and in this event, the acetyl coenzyme A, two molecules of acetyl coenzyme A, they combine together to form the parent ketone body, which is acetoacetate or acetoacetic acid. And this acetoacetic acid further breaks down into two other products, which are also ketone bodies. One is beta hydroxybutyrate, the other one is acetone. Okay, so these are the three main ketone bodies which are formed in the body. Okay, acetoacetic acid, beta hydroxybutyric acid, and acetone. Out of which acetoacetic acid is the primary ketone body, whereas beta hydroxybutyrate and acetone, they are considered as secondary byproducts of acetoacetate. The fourth ketone body is also produced, but in very less percent of animals, less than 5%. That is breakdown of acetoacetate in isopropyl alcohol, which is the fourth ketone body. And this isopropyl alcohol is responsible for 5% nervous form of ketosis. Okay, it has got direct deleterious effect on the nervous system, and because of that, 5% of ketotic animals, they will show nervous signs or nervous form of ketosis. And this isopropyl alcohol is responsible for that. Okay. So this is what, out of which these ketone bodies, you can understand that the acetone, it is being a highly volatile type of compound. It gets excreted through the body through exhaled air. It enters into the pulmonary circulation because of its volatile nature, and through the expiration, it comes out of the body. So that's why acetone is rapidly excreted in the body, but the acetoacetate and beta hydroxybutyrate is retained into the system, thereby causing ketonemia. Okay. Now coming down to the clinical signs. Okay, in clinical signs, there are two distinct forms of ketosis. One is wasting form, which is about 90% of the animals that suffer with this type of form, wasting form, and we will just come to know why it is called as wasting form, because the animal loses weight very rapidly. Okay, and woody appearance is a very distinct feature of wasting form of ketosis, and in most of the Western books, they have named it as woody cow. Okay, a good-looking animal suddenly loses a lot of weight, and the rib cage and the major bones, they are visible. So that is called as woody appearance. Okay, so one by one we'll see what are the distinct clinical findings of wasting form. They call it as selective appetite. Okay, a very distinct characteristic feature of a ketotic animal. What is that selective appetite? The animal eats roughages and refuses concentrate. So refusal of concentrate is a very distinct feature in a ketotic animal. And I tried to search the literature as well as the scientific reports. What is the theory behind this? Okay, so nobody has justified why this type of selective appetite is observed in ketotic animals. So over a period of time, I formulated my own hypothesis. So the animal understands that the highly concentrated concentrate which is being fed to the dairy animal is not the requirement. The requirement is roughages. So that's why the animal tries to eat roughages on the contrary to the concentrate. It refuses concentrate diet, but at the same time, it keeps on eating hay or roughages. So it tries to give a indication that that is the one which probably will take the animal out of this clinical syndrome. Okay, and it has been well documented. There are a lot of zoologists working on animal behavior. It has been observed that in wild, the animals which become sick, they have got a tendency to eat specific herbs, and the zoologists, they have tried to bring a correlation, and it has been observed that these herbs, they are rich in certain components. Okay, maybe antibacterial effect or something like that. So the monkeys, chimpanzees, it has been very well documented. They have a selective appetite. When they become sick, when they feel they don't feel healthy, or they feel that they are suffering with one or the other problem, they try to eat a specific type of herb. Okay, so because of that, uh, because of that, uh, they try to come out of that. So here also you can understand that probably uh, the dairy animals also try to give an indication that they want roughages over concentrate. Okay, then there is a sudden and severe drop in milk yield. The cow or buffalo giving around uh, 10 liters of milk, suddenly the milk yield is dropped to about 2 to 4 liters, which is a worrisome factor for the farmer. Okay, this is another distinct clinical finding in animal with ketosis. Low SNF, solid not fat, is also a major problem, and the refusal of milk in the milk centers, milk collection centers, is also a major problem associated with ketosis. Woody appearance, I told you, this is basically because of the lipolytic effect. Okay, and subcutaneous fat is the major source of energy for gluconeogenesis. So subcutaneous fat is rapidly mobilized, and because of that, a good, very roundly looking, healthy animal suddenly loses weight, and it looks like uh, woody cow. Okay, so that is the justification for appearance, woody appearance of a ketotic animal. Another important feature is pronounced sweetish smell. As soon as you go near to a ketotic animal, you find that a typical pungent sweetish smell is coming. So this is nothing but the acetone, which is coming out of the body. Okay, I told you in the formation of ketone body. Acetone is a volatile compound, and it is rapidly excreted from the body in exhaled air. It goes to the pulmonary circulation, and through exhaled air, it comes out of the body. So as soon as you approach a ketotic animal, you get a typical pungent smell, acetonic breath, they call it. Okay. Apart from that, the whole, the sojourn of the alimentary tract is also affected. Because of that, the fecal, the contents in the intestine, that retain more period of time, and because of that, there is more absorption of water. So that's why uh, you can see the dry mucus coated feces. You will have a typical mucus coating on the fecal pellets. So this is also a distinct feature in case of Western form of ketosis. Then I told you one more form which is very less common. Around 5 to 10% animals, they show this type of form, and the isopropyl alcohol, which is also a type of ketone body, is responsible for this nervous form. So variety of clinical features, they can be seen in nervous form of ketosis. The animal walks in circle, then it presses its head against the wall or stanchions, leaking of inanimate objects, skin, constant leaking of the skin and inanimate objects, hyperesthesia sometimes, and in many of the animals you find convulsions. Okay. So these are the two different forms of ketosis which are occurring, out of which around 80 to 90% of the cases they show the wasting form, and about 10 to 15% cases they show the nervous form. Now the diagnosis. The Rothera's test, I always insist, it is a very simple kind of test, and I think the organizers, they are taking out a this compendium also. I have given a write up also. In that, I have explained briefly how the Rothera's test is to be conducted. For just refreshing the audience attention. Let us go through that. Rotra's test is the gold standard test for the detection of ketone bodies in the urine, and it is a very simple test. It can be performed in any dispensary. You need to have around 3 to 4 ingredients. What is that? In Rotra's test, the reagent required is ammonium chloride or ammonium sulfate as a chemical, then sodium nitroprusside as a chemical, and ammonium hydroxide or strong ammonia solution. Only these three chemicals are required, and any dispensary you can have it. And the simple how to perform a test: in a test tube, you have to collect the urine. Let me tell you, the urine sample should be fresh, because the stored samples, they react lately to the Rothra's reagents. So that's why freshly collected sample will give a very accurate test. So about 5 ml of urine you have to collect in a test tube. You have to add ammonium chloride, and they call it as saturation of urine with ammonium chloride. Means you keep on adding ammonium chloride to the test tube having the urine till you get a sediment at the bottom. It means it has reached to a saturation stage. Okay. So after that, you have to add. There are two ways. Either you can add a very small crystal of sodium nitroprusside to this, or you can prepare a 5% sodium nitroprusside solution. Okay. So if you are using solution, 1 or 2 drops of sodium nitroprusside, 5% nitroprusside to be added to the urine, which is already saturated with ammonium chloride. Okay. Or otherwise, if you have not prepared any sodium 5% sodium nitroprusside solution, you can take a small crystal of sodium nitroprusside and you have to add to it. Then mix it again. Okay. And then you have to add sodium, so ammonium hydroxide or strong ammonia solution. Care should be taken that both the solution, they do not mix. So that's why you have to tilt the tube wherein you have to collect it. You have already having the urine which is saturated with ammonium chloride, and you have added nitroprusside. So you have to tilt the tube, and from the side of tube you have to add ammonium hydroxide or strong ammonia solution. So it will form a layer above the urine sample. Okay, don't mix it. And then wait for about 30 seconds to 1 minute. You will find in positive cases a violet color ring will appear at the junction of two liquids, that ammonia solution and the urine sample. So this permanganate color or violet color ring will say that the Rothra's test is positive. This is very simple. Okay. And even during my research, basic research, I have found that the intensity of this violet color, uh, intensity of this violet color is directly proportional with the ketonuria. How much of ketone is there? Stronger is the ring for permanganate color or violet color ring, more of the ketone bodies they are there in the urine. Okay. So this usually I used to use it for differentiation. Okay. You must have read, and I have not given more emphasis in the types of ketosis, because we are discussing primary ketosis, which is more commonly encountered in daily animals. Okay. We are not discussing the secondary ketosis, which is which can occur because of the elementary, means some digestive disorder is there, or sometimes if the animal is fed with high butyrate. So this butyrate will reduce the concentration of acetate and propionate in the urine, thereby causing ketosis. The animals suffering with mastitis, metritis. Okay. So in these animals also there is a what you can call it as depressed appetite, and depressed appetite ultimately gives a chance for enhanced gluconeogenesis and secondary ketosis. So always in secondary ketosis there is a faint color violet ring, permanganate color ring, whereas in primary ketosis very intense dark permanganate color ring will appear at the junction of the liquids. Okay, this is a very simple test. It can be performed either on the urine or milk sample, but preferably the urine. Okay. Then the supportive other parameters which can help to you to come down to conclusion whether there is a ketosis or not, that is hypoglycemia. Okay. So normal glucose concentration in ruminant animal ranges between 40 to 60 milligram per deciliter, and you will definitely find a ketotic animal will have a glucose concentration less than 40 milligram per deciliter. I'm going to share few images in the next slide. There you will understand the variety of. Now there are different methods are there. Enzymatic biochemical estimation of glucose also is very easy, but and it is a very rapid test as a matter of fact. Okay, it is a single step biochemical estimation. You have to add only one reagent to this serum, and then you have to take the reading in a automatic biochemical analyzer or even the colorimeter. Okay, so you will get the concentration of glucose. Okay, or you can submit the sample to any private lab. Within no time, they will tell you what is the glucose concentration in the animal. Nowadays, the glucometer they have come to the handy, and in the next slide I will tell you how it can be used as a pen side diagnostic tool to say whether hypoglycemia is there in the animal or not. Then the ketonemia is there. Ketonemia, little bit, you need to have a special setup to estimate acetoacetate. So acetoacetate, any value more than 10 milligram per deciliter, it says that the ketonemia is there. Nowadays, much of the stress is there on the beta hydroxybutyrate. Just like glucometer, beta hydroxybutyrate meter is also available in the market, costing around 6,000 to 7,000 rupees. It also is supplied with test strips. So you have to apply a small 1 drop of blood, and then you have to insert this strip into the beta hydroxybutyrate meter. Okay, and it will tell you how much of beta hydroxybutyrate is there. 1 milligram is the upper limit for beta hydroxybutyrate. So any animal which is showing more than 1 milligram value in the beta hydroxybutyrate meter, it says that the animal may be having a subclinical or clinical ketosis. Okay. Then apart from that, some additional parameters also can be kept it in mind, because there is a elevated free fatty acid concentration in ketotic animal. So you will always have a high triglyceride and free fatty acid concentration in the serum. So they will add as a adjunct parameters for the confirmation of ketosis. Nowadays, ready-made dipsticks are available in most of the medical shops, which are routinely being used to see the glycosuria and ketonuria in case of human patients. The same strips can also be used to see whether ketonuria is there or not. But it is a qualitative test. It will not give you, though the color will indicate how much of ketonuria is there, but it is not a confirmatory method. You can just say whether it is positive or negative. Okay, but the best way is Rothra's test, estimation of glucose in the serum, and then the elevated free fatty acids and triglycerides. Okay. Liver glycogen estimation is also there, but it is again you need to have the liver biopsy, and then you can estimate. But it is only an experimental stage. It can be. Then this is what I wanted to share. We had an apprehension whether the glucometers which are already standardized for human glucose, whether they can be used for ruminant animals or not. But we have seen one of our university student is working on this, and we are getting very good and rapid results. Okay, so he is using this one-touch glucometer for the estimation of glucose, which can be taken to any farm, and beside the side of the animal, you can perform the test and you can know what is the glucose concentration. Then the second one, here you can see the keto diastics. This is already ready-made diastics are available in the most of the medical shops, and that is also a very easy. You need to have a 5 ml of urine sample, and the diastics has to be inserted, kept dipped into the suspected urine sample, and it has to be removed, and then it has got a you have got a color chart along with the strip bottle, and you have to just match where it is matching. So it will tell you negative 0.5%, 0.1%, 1.5%, just like glucose. Okay. So for glycosuria also test strips are there. For ketonuria also test strips are there. Okay. So this is a double. You can estimate. You you can see the glucose as well as ketone. There are two color charts are there, you see here. Okay, so this is glucose chart, and it will tell you how much of glycosuria is there. This is the ketone chart, and it will tell whether it is negative or positive. And if it is positive, how much of percent ketonuria is there in the animal. Okay, so they are routinely using for human patient, and we have tested in animals also, and it gives you a rough idea whether the animal is positive for glycosuria and ketonuria. So in ketosis, you will never get a glycosuria, but you will get ketonuria. Okay? But in case of human patient, glycosuria and ketonuria, they go hand in hand. Okay, so that's why the test strips have been designed in such a way. Two parameters can be tested at once, like glucose as well as ketone in the. Okay. Now here you can see this is a beta hydroxybutyrometer. Okay, so here you can see it is 1.1. Okay, so it is on the higher side. It is a subclinical ketosis case. Okay, 1.1 value is considered to be a subclinical ketosis case. Here you can see 1.7 beta hydroxybutyrate in the serum in the blood sample. So what you have to do is you have to either collect the blood from the jugular vein and put a drop on the test strip. The test strip has to be inserted into the beta hydroxybutyrate. Okay. The other simple way is puncture the ear vein. Okay. Insert the test strip in the beta hydroxybutyrate, puncture the ear vein, and then apply the sample spot. Okay, to the blood which is oozing through the ear vein, and then make a reading. So within 30 seconds, the reading will flash on the screen, and the reading will tell you whether it is positive or negative. Here you can see both the glucometer as well as the beta hydroxybutyrometer has been shown, and here you can see the beta hydroxybutyrometer is showing a reading of 1.7, which is a clinical ketosis, and then 39, which is definitely less than 40. Of course, it is not clinical; it is also again a subclinical, but it can be used as a predictive value. Okay, and in few cases we have seen that the drop of glucose up to 25 milligram per deciliter. Okay, so likewise elevated 2.83 milligrams of beta hydroxybutyrate also has been recorded in beta hydroxybutyrate. Okay, so these are all what you can call it as a rough estimate to say, and these are pen side diagnostic tools which can be used for the diagnosis of ketosis. Okay. Now coming down to the treatment aspect of ketosis. So the treatment of ketosis, it revolves around four concepts. Okay, the first concept is replacement therapy. The second concept is combined replacement therapy with insulin. The third concept is glucocorticoids, and the fourth concept is propionic acid precursors. Okay, so one by one we will see what is the concept behind the each regimen. Okay, so first is the replacement therapy. So what is replacement therapy? Everybody knows that in ketosis there is hypoglycemia. Okay, so this glucose has to be supplemented. It is nothing but the replacement therapy. Okay, so the glucose has to be replaced into the system at a specified dose. Okay, so hypertonic dextrose is the preferred medium, preferred therapeutic regimen which is used, and people have used starting from 10%, 20%, 25%, 50% in the treatment of ketosis. Okay, and the dose rate is 0.5 gram per kg body weight. Okay, so let us presume an animal is weighing around 300 kg, suffering with ketosis. So the requirement, if you go by the theoretical value, is 0.5 gram per kg body weight. Means a 300 kg animal will require 150 grams of glucose as a treatment regimen. Okay, so the variety of, as I told you, people have used from 10% to 50%. Okay, but my suggestion and my advice to the field veterinarians is go with a 10% glucose solution, dextrose solution, because there is already a dehydration, and hypotonic dextrose solution more than 10% will complicate the condition. So that's why, and the amount of, why people prefer to go for hypertonic up to 50% to reduce the total quantity of glucose. See here, when you say 10% is preferred, so 150 grams means around 1500 ml of 10% glucose is required. to give the requisite quantity of glucose for a 300 kg animal. If you go to 20%, the volume will be reduced to 50%. Okay, 1500 ml will become 750 ml, isn't it? Whereas if you go to the 50%, 50% glucose solution means you need hardly 300 ml of 50% glucose solution. Okay, so it will supplement around 150 grams of glucose, where animal weighing 300 kg. Okay, so because of that, people have formulated variety of therapeutic regimens. But in my MBSc work, we have found that 10% dextrose solution should always be preferred, and it has got a beneficial effect, because if you go for more hypertonic solution, the glycosuria is very prominent, the glucose excreted from the body is very rapid, and it will not give the fruitful results. So that's why it is my suggestion is preference to 10% dextrose solution. What are the drawbacks for this? The response is delayed. You have to give this hypertonic dextrose for at least 3 to 5 days to make the animal to come out of the ketotic state. Some of the animals they respond in 2 days, but some of the animals they require at least 5 injections. Okay, so 5 consecutive days you have to treat the animal with hypertonic dextrose. Okay, the second and very well documented and identified defect in ketotic animal is hypoinsulinemia, which we are going to discuss in the next slide. So because of hypoinsulinemia, insulin is very much required for the proper utilization of glucose. Insulin helps in entry of glucose inside the cell for its metabolism, its utilization. Okay, so there is a, they say that the scientific reports say that the elevated ketonemia has a direct effect on the pancreas, and because of that the insulin secretion from the pancreas is reduced. So in ketotic animals, the requisite quantity of insulin is not there. So when you treat the animal with hypertonic dextrose, the utilization of glucose as a therapeutic regimen is not achieved, and much of the glucose is excreted in the urine. Okay, so glycosuria is very imminent in case of the animals which are treated with hypertonic dextrose in absence of or in a reduced level of insulin. So that's why during my MBSc research, we proposed combined treatment regimen wherein the hypertonic dextrose should be given at the rate of 0.5 gram per kg body weight intravenously, and it should be coupled with insulin. Okay, at the rate of 0.5 units per kg body weight. It can be given either by subcutaneous route or intramuscular route. So this helps in better utilization of glucose. Okay, efficient utilization of glucose is seen, and the number of treatments can be reduced to 1 hour. Okay, whereas glucose alone may require at least 4 to 5 treatments to make the animal to come out of the ketotic state. Okay. Now, one very important thing which you has to be kept it in mind is when to give insulin and what type of insulin should be given. Okay, so you don't require the insulin to stay in the body for a longer period of time as that of diabetes. Okay, in diabetes, long-acting insulins are preferred because you have to have an insulin effect over a period about of 8 to 10 to 12 hours. Okay, here it is not required. What you want is you are giving a dextrose, hypertonic dextrose intravenously, and it should be used effectively. So you need to have a short-acting insulin. Okay, so always try to keep it in mind that the insulin which you are using for the treatment of ketosis should be short-acting. Okay, the effect of insulin should not go more than 1 or 2 hours, 1 hour maximum or 1.5 hours. So that's why short-acting insulin at the rate of 0.5 units per kg body weight should be used and to be given by either subcutaneous or intramuscular. Now, the most important thing which should be kept in the treatment of ketotic animal with dextrose and insulin is already the animal is in hypoglycemic shock. Okay, in a hypoglycemic state, we have seen biochemically, isn't it? Ketosis, there is a hypoglycemia. Okay, so insulin should be given at least 10 to 15 minutes after initiation of hypertonic glucose administration. Otherwise, it can be disastrous because already the animal is hypoglycemic. If you give insulin very early, it can cause a hypoglycemic shock. So you have to initiate hypertonic dextrose therapy, and after 10 to 15 minutes, when sufficient hyperglycemia has occurred in the body, you have to inject insulin at the rate of 0.5 units per kg body weight by subcutaneous and intramuscular. So thereby, the effect of insulin on hypertonic hyperglycemic phase will be there, and utilization of glucose will be. So it will give a better effect. Okay. So let me share my experience. My paper was very much appreciated in 1990 World Buffalo Congress, which was held in New Delhi. My professor and guide, Professor Bhup Singh, presented the paper, and it was appreciated very much in World Buffalo Congress. And then we published our research finding in Indian Veterinary Journal, Indian Veterinary IVJ, Indian Veterinary Journal, and Indian Veterinary Association was kind enough to recognize as best clinical innovation, and Dr. Swaminathan Iyer gold medal was awarded to me and my professor in the year 1990 for best clinical research, and that was a breakthrough in the treatment of ketosis. And for years together, we continued to promote the combination therapy, hypertonic dextrose along with insulin. Okay. Later we will see what are the new innovations in the treatment of ketosis. Okay. The third option, what we have seen is the glucocorticoids. Okay. The glucocorticoids is very understandable. Glucocorticoids, they promote the gluconeogenesis, and thereby it can come to the rescue of the ketotic animal because there is a requirement of glucose. Now, one doubt which may crop up in everybody's mind, that we have understood that the elevate or enhanced gluconeogenesis is the primary reason for acetyl coenzyme A production in the system and ultimately leading to ketosis. Then how scientific temperament says that the glucocorticoids can be used for the treatment of ketosis, because they also promote the gluconeogenesis, which you do not want as a matter of fact, isn't it? Because gluconeogenesis is nothing but utilization of or production of glucose from non-carbohydrate sources. Okay, the glucose is produced at the end of beta oxidation, but at what cost? It will add up acetyl coenzyme as a byproduct, and this acetyl coenzyme in normal physiological situations get oxidized by combining with the oxaloacetate, and it doesn't accumulate in the body. But if the gluconeogenesis is going at a rapid rate, acetyl coenzyme A, which is a byproduct, will not be utilized through Krebs cycle. Okay, and it accumulates and ends up into acetoacetate and beta hydroxybutyrate and ketone acetate. So what is the scientific basis? Scientific basis says that if natural process of beta oxidation is there, much of the lipids, lipolytic effect is there. Okay, if you give a chance for the body for to act or to potentiate or to go the gluconeogenesis on a higher rate, it utilizes fats as a priority. And when fats are utilized, the acetyl coenzyme A production is more. Whereas protein, if they are utilized for the gluconeogenesis, the burden of acetyl coenzyme is less. So here the concept is the same. Glucocorticoids, they cause preferential gluconeogenesis. They break down the protein rather than the fats, and thereby reduce the acetyl coenzyme. So thereby they must be contributing as a good therapeutic regimen for the treatment of ketosis. Okay. So the two prominent glucocorticoids which are routinely used by the field veterinarians, during my research, MBC research also, we have used this triamcinolone acetonide. That time it used to be marketed by SARA as Wetcott. Now the Wetcott has changed. They have replaced this triamcinolone acetonide by isoflurpridone acetate. It's a new steroid which also has got a glucocorticoid as a mineralocorticoid effect. So this can also be used at the 0.05 milligram per kg. So during my research, I have used the glucocorticoid alone as well as in combination with the insulin. And in both the things, we got a response, good response. but not as that of glucose and insulin. Okay, so if you give me to interpret the glucocorticoids, it comes as a second choice for the treatment of ketosis in my sense, because the response to glucose along with insulin is much better when compared to glucocorticoids with insulin. Okay. So this is the concept why it is promoted as a therapeutic regimen for the treatment of ketosis. It causes preferential gluconeogenesis, breakdowns proteins, not the fats, which will reduce the burden of the acetyl coenzyme. Okay. Then the recent focus. Okay, what is research? Research is means searching again and again. Okay, so over a period of time, way back in 1990, we proposed that the best therapeutic regimen for the treatment of ketosis is hypertonic dextrose in combination with insulin. But recently, much of the workers, they have focused that what is the basic problem in ketosis. We say that the propionic acid is not produced in requisite quantity in the rumen, isn't it? So if you promote the propionic acid production in the rumen, it will solve the problem, isn't it? So that's why this concept came into the picture. Recent focus is on propionic acid precursors, because propionic acid precursors, they increase the propionate production in the rumen. And when propionate is increased in the rumen, automatically the oxalate rate also is improved, and oxalate, if it is in sufficient quantity, whatever acetyl coenzyme is produced in the system will be utilized through the Krebs cycle, and there is no accumulation of acetyl coenzyme. So that's how the recent focus in the treatment of ketosis is propionic acid precursors. So 2 or 3 compounds are very routinely being used either alone or in combination with the some of the amino acid supplements and multivitamin supplements. So propylene glycol or sodium propionate at the rate of 225 grams can be given either alone or enriched with methionine 6 grams and nicotinic acid at 8 grams. Okay, so this combination therapy nowadays is being promoted as a primary therapeutic regimen for the treatment of ketosis. Then there are so many other scientific publications are there which promote the use of anabolic steroids, then invert sugars like fructose rather than dextrose, and cysteamine and vitamin B12. But now the much more understood concept is the treatment of ketosis can be focused on supplementation of propionic acid precursors like propylene glycol, sodium propionate, or even glycerinol. Okay, all of them, they will improve the production of propionate in the rumen and thereby solving the problem of ketosis. Now the prevention and control of ketosis. So the ketosis, the other alternate name for ketosis is estate acidonemia. Means the animals which are very fat during the periparturient period, they have increased inclination, because immediately after parturition, hepatic lipidosis and other things, they come into the they make the hepatic lipidosis and then make them animals susceptible to ketosis. So you have to see that you will avoid fattening during the late gestation. The animal, the body score plays a very important role. They say that on 5-point scale, the periparturient animal should have a body score of 3.5. In human beings also, nowadays we talk about BMI, body mass index, and 25 is the upper limit for human. So likewise, they say that for animals, the body score should range between 3.5 to 4. It should not go more than that. Okay. So the animals which are less fatty during the late gestation, they have a less inclination to a susceptibility for ketosis. Then we have seen that metabolic profiles should be maintained on a larger farm, and if there is any deviation in the metabolic profiles or a specific metabolic parameter, essential dietary modification should be taken up so that the animals will not suffer with a periparturient. Then you have to always encourage dry matter intake. At least 15 to 20% of daily intake should be roughages. So thereby, specific this DMI will improve the propionate production in the rumen. Thereby, it will suffice the requirement of glucose in a dairy animal. Then essential vitamin and mineral supplements during the late gestation as well as immediately after parturition is also promoted, because most of the vitamins and minerals, they act as bioenzymes in variety of biochemical reactions which are going on in the body. Okay, so thereby they will support the utilization. Okay, they say that the lactate which is accumulated in the body can be reversibly converted into pyruvate. So for that you require B12. Okay, so B12 supplementation is very much required for the conversion of lactate into pyruvate. If you don't supplement it, lactate accumulation occurs and it becomes irreversible. Okay, and it can add up into lactose and other things. So I'm just giving an example. So supplementation of vitamins and minerals should be a priority during late gestation as well as immediately after parturition. Then prophylactic feeding of sodium propionate at the rate of 110 grams per day immediately after parturition. They say that about 3 to 4 weeks you can always feed sodium propionate at a subtherapeutic dose. In treatment, you have seen it has to be given at 225 grams per day. Here you have to give 110 grams. So if you supplement sodium propionate at the rate of 110 grams per day for at least first 3 to 4 weeks, you will reduce the incidence of ketosis to almost nil. Okay. Then this also has been proposed that feeding of ground maize during 4 weeks postpartum. Okay. They say that the concept behind this is ground maize contains alpha polymerized glucose. It is a special type of glucose. Okay. And this alpha polymerized glucose, so you just try to understand why we cannot give glucose orally. When you say that the glucose hypoglycemia is there in ketogenic animal, isn't it? The easiest way is supplementation of glucose by oral route, but we don't follow it, because if you give glucose orally, it ends up into lactic acidosis, because glucose gets it is a highly fermentable product, isn't it? It ends up into formation of lactic acid, and it ends up into lactic acidosis. So you need to have a glucose which will resist the breakdown in rumen. So that's why they call it as alpha polymerized glucose is a bypass glucose. It doesn't get degraded or metabolized in rumen. It bypasses the rumen, and this glucose is available in the lower intestine or maybe in the abomasum, okay, where it can be absorbed and it can elevate the glucose concentration in the serum. So that's why they say that feeding of ground maize can also be a alternate prophylactic measure for the prevention of ketosis. Okay. Then we will go to the second topic. Dr. Bikane was very much, interested. He said that, sir, you have worked on lactic acidosis during your doctoral research. So let us have discussion on subacute ruminal acidosis. In short form, it is called as SARA, and it is an emerging threat to the dairy industry, especially on large dairy farms where grain feeding, especially in West, I'm talking about the Western concern. Okay, grain feeding has led to a very prominent metabolic disorder, that is subacute ruminal acidosis. Okay, and in other terms, it is also called as low milk fat syndrome. It is also called as MFD, milk fat depletion, MFD. Okay, or even also LMFS, like low milk fat syndrome. Now, there is a craze among the dairy owners, dairy farmers, that the high energy energy diet should be given to the animal to have a better production postpartum, which is a wrong concept. Okay, and people, they do not give much of their what you can call attention to the nutritionists' remarks, and they always think that if a high energy diet is given during prepartum period, probably you will achieve a highest production during the postpartum period, which is a myth, which is a misconception. Okay, so as a matter of fact, high energy fermentable energy diet, it increases lactate production in the rumen, because there is a shift in the microbial population in the rumen ecosystem, and this normally it has been observed that the gram-negative organisms, they predominate in normal human ecosystem. Okay, so when you give a highly fermentable type of carbohydrate or energy diet, it increases production of lactate in the rumen, and that changes the proportion of gram-negative to gram-positive, especially two what you can call as villains in the rumen ecosystem. They are identified. One is called as Streptococcus bovis. Anyway, in pathopathogenesis, we will discuss more about that. Streptococcus bovis and Lactobacillus. They are the main gram-positive organisms responsible for lactate production in the rumen. Okay, so increased production of short-chain fatty acids are also contributing for the SARA. Now, epidemiology and pathogenesis. You have to understand that the SARA is becoming a herd health problem nowadays. In large dairy farms, it is a major problem. And unless and until you make dietary modification, you are not going to come out of this herd problem. Okay? The incidence of SARA ranges from 19% during early lactation. It can reach up to 26% in mid lactation in mid and large size dairy farms. And basic problem is non-adaptability of rumen ecosystem to diets which are high in carbohydrates. Okay, so the low pH favors, as I told you, Streptococcus bovis and Lactobacillus. These are the two main gram-positive organisms which utilize the low pH and the fermentable carbohydrate in the rumen for the production of lactic acid. Okay, so this increased lactate in rumen is a unfavored product in the rumen ecosystem. So this lactate has got a high molecular weight, and because of high molecular weight, it changes the osmolarity of ruminal fluid. Okay, and changed osmolarity means it becomes hypertonic. Okay, because of high molecular weight product in the rumen, there is an increased osmolarity, and increased osmolarity increases the hypertonicity. Okay, so the rumen fluid becomes hypertonic and it drags much of the fluid from the system and thereby causing engorgement of rumen, which is very distinctly observed in acute carbohydrate engorgement. So acute carbohydrate engorgement is an acute problem. SARA is a subclinical and what you can call as continuous process. Okay, but the end result is the same. Okay, so there is a rumen distinction. So rumen distinction is one factor. Apart from that, changed rumen ecosystem. Gram-negative organisms, they die because of the change in pH, and during the low population of gram-negative, and they release the endotoxins. And basically, these endotoxins and the histamine, which is released in the rumen, is responsible for ruminal hypomotility. And that's why rumen tonicity is not at all there. The animal becomes totally anorectic over a period of time. Okay, so partial to complete anorexia is a very distinct feature in SARA, and this is because of the suppressed rumen motility or rumen hypomotility. And the main reason is released endotoxins because of the death of the gram-negative organisms and the release of histamine. Okay. Loss of condition in spite of good nutritional diet. Okay, so loss of condition. The reason for loss of condition is negative energy balance and suppressed anabolism. Okay, and low fat syndrome. So the milk is depleted with fat. This is because of the low acetate in the milk. Okay, so acetate and butyrate, they are the two prominent volatile fatty acids which contribute for the milk fat concentration. Okay, so when there is a depressed acetate in the rumen, it has got direct bearing on the fat content of the milk. So low fat syndrome is a very distinct feature of SARA. What are the clinical findings of SARA? Loss of condition in spite of high energy diet. Okay, the farmer will always say that, sir, I am following a very appropriate dietary regimen in my farm. I am giving a very good concentrate to the animal. In spite of that, I am finding that the animal is losing weight. Okay. There is a loss of condition. Low milk fat syndrome is again major complaint by the farmers, because it has got a direct bearing on his income. Because such milk, if it is taken to the milk center, it will be rejected because of low fat. That is one thing. If it is he is selling it to the customers, consumers. Consumer will always complain that your milk is very thin. It is not giving a good, what you can call as fat layer. When I'm paying around 50 rupees, 55 rupees per liter of milk, when I'm trying to get fat out of that, I'm not getting the requisite quantity of ghee, isn't it? So this is a major problem for the farm, low milk fat syndrome. It is also called as MFD. MFD stands for milk fat depletion. Okay. Partial to complete anorexia, because there is a ruminal atony, isn't it? So ruminal atony will contribute for the loss of appetite. Okay. Apart from that, it has been observed that the lactate which is absorbed through the rumen ecosystem, it goes to the liver, and it also causes hepatic insufficiency, suppression. Okay, suppression of hepatic function. And in Western countries, they say that the liver abscesses is a major cause of SARA, subacute ruminal acidosis. Okay, so hepatic abscesses, they contribute for the suppressed hepatic function, and suppressed hepatic function, it contributes for the appetite. Okay, so the partial to complete anorexia is another important clinical finding of SARA. Then intermittent bouts of diarrhea. They say that the contents in the rumen, they do not get digested because of the low tonicity of the rumen. It doesn't get mixed up, and the particle size in the rumen, it is large. Okay. So that already I have given you in the writer what is the particle size, and this particle size induces osmotic diarrhea. Okay. There is an intermittent bouts of diarrhea. Okay. And in late stage laminitis, it is a very well proved fact that lactic acidosis is the basic reason for laminitis and solar ulceration. Okay. Dr. Pajay, am I audible to you?
Yes, sir. Yes, sir. Yes.
Okay. So what is the diagnostic approach for SARA? That is rumen fluid examination, because the main reason is that, isn't it? The ecosystem has changed. So you have to do a rumen fluid examination. In that, you have to see the pH, which will definitely less than 5 or 5.5 acidic, indicating of acidic nature. Then if you go for total protozoal count and total microbial count, you will definitely see there is a decline. Protozoal count, sometimes it may be reduced to 1+.
अजय सर.
No problem. Hello.
सर रिजॉइन होता है.
Oh, okay.
Am I audible?
Yes,
Am
you are
I
audible, sir.
Okay, okay. Sorry, there is a connectivity issue here.
Yes.
Am
sir.
I audible now? Hello? Okay, yeah. Dr. Pajay, please respond.
Yes, sir. You are audible, sir, but some disturbances are coming in between.
Is it clear now? Yeah, can you see the slide?
No, sir, not yet.
Slide is not visible.
No, sir.
One minute. Is it now, Dr. Pejai?
You're audible, sir, but screen is not shared.
I'll share screen. Now?
Yes, yes, it is visible, sir.
Visible?
Slide mode. Slideshow mode. Slideshow mode.
Is it?
Yes, yes, sir. Yes, it is okay, sir. Okay.
So, in brief, rumen fluid examination, where you have to see the pH, microfluid count, methylene blue reduction test, it should be less than 3. Iodine test will tell you whether the microflora, especially the protozoa, whether they are taking the starch or not. You can estimate blood lactate and bicarbonate. Hepatic enzymes like AST and GGT can also be measured to know whether any hepatic insufficiency is there or not. Then what is the treatment and prevention options? Limiting highly fermentable concentrate, promotion of coarsely chopped dry fodder, so that it should be at least 15% of the daily ration. Then slow adaptation to the grain diet, feeding of ionophore antibiotics like monensin, salinomycin, which will promote more of propionate in the urine, in the rumen, as well as it will suppress the lactate producing organisms also. And nowadays, the stress is on prebiotic and probiotic like Saccharomyces, Megasphaerocidini, Salomonas ruminatum. So these are available as commercial preparation, can be given to the animal to control the subacute ruminal acidosis. So thank you one and all. I would like to thank Dr. Bikane for identifying me as a key speaker for this international training. And I am also thankful to Mahapsu for giving me an opportunity to share my views, and Alembic Pharmaceuticals, who are also co-sponsors for the training. Thank you one and all.
Sir, join.
Dr. Ravindra Jadhav, sir. Kindly display the questions.
Sir, screen is visible to you, sir?
Yes, yes, Naresh, it is visible.
Yeah, first question is, can combined therapy of hypertonic dextrose with insulin and corticosteroids can be used? Only research will tell about that. We have not tried, because these are the two different concepts. Hypertonic dextrose and insulin is one concept, and corticosteroid or glucocorticoids is another concept. So only that's why they are used independently. Okay, they are not used combined. Okay, what is the normal of BHB level in urine? BHB is difficult to detect in the urine. So blood, I have already told you, 1.1 is the normal level. If it is anything more than that, it is considered as elevated BHB, and it is considered as subclinical ketosis. sodium bicarbonate is beneficial to overcome acidosis. It may reduce the pH, but it will not suppress the byproducts which are occurring in the urine. So it may not be a good concept to reduce the sodium bicarbonate. You have to see that the product, the substrate which is contributing for the lactate production has to be reduced.
Thank you, sir. Thank you for answering all the questions which were raised by the participating vets. Thank you for your excellent presentation, sir. Over to Dr. Ravindra Jadhav, sir.
So Dr. Kasradikar sir has delivered a nice presentation on important topics that is related to the production in dairy animals, that is ketosis and subacute ruminal acidosis. So on behalf of organizing committee, I once again thank you, Dr. Kasradikar sir, for delivering excellent presentation. Thank you, sir.